Hi, everybody. Hello, everyone. Welcome to Mustella's 360 Approach to Eczema webinar. Thank you so much for joining us. My name is Elena Montaigu. I'm the VP of Marketing and E-Retail for Mustella. So we'll be together for the next 45 to 50 minutes, and we'll be discussing holistic approaches to caring for eczema. The webinar today is recorded and it will be posted on our medical website, mustellamd.com. So feel free to connect there after the webinar in case you're missing anything. Also, we will be sharing a few questions at the end. So we will try to save some time for a quick Q&A. So please drop your questions in the chat during the presentation. And our presenters today will do their best to answer those. So today, we have two phenomenal speakers. So thank you so much, Dr. Leo and Dr. Debelilovsky. So Dr. Peter Leo is a clinical assistant professor of dermatology and pediatrics at Northwestern University. He's also a board member and scientific advisory committee member emeritus at the National Eczema Association. He's a member of the AAD's atopic dermatitis expert resource group and a founding faculty member of the Integrated Dermatology Certificate Program. So we're very honored to have you with us, Dr. Leo, today. Also joining us today is French dermatologist Clarence Debelilovsky. Dr. Debelilovsky has her MD in dermatology and a master in cutaneous biology and cosmetology. She's a long-term consultant in the Department of Dermatology and Venerology at the Hospital Alfred Fournier in France. Dr. Debelilovsky is a medical advisor and responsible for the scientific communication for Mustella. So we're very happy to have her with us today. So thank you again. And just like that, I'd like to hand it over to Dr. Leo.
Great. Thank you so much. Let's see, I will request here and perfect. So we're going to talk about a holistic approach to eczema with this focus on complementary and alternative medications, or CAM, sometimes called integrative dermatology. These are my disclosures. And we know that atopic dermatitis or eczema really is incredibly challenging condition, in part because it is so heterogeneous. There are so many different presentations and each patient is a little bit different. Sometimes it's oozy and weepy. Sometimes it's very thick and leathery or lichenified. So we have this incredible range that we have to deal with. And sometimes these are actually happening at the same time in the same patient, just different body areas. So it really requires a lot of our attention and focus to try to get things better. Of course, it also changes day to day. Each patient has different patterns of disease. And this is some example ideas where some patients have very spiky disease, where it's going up and down over time. Others, they're seeing a seasonal flare. It's quiet, 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 and then a big flare up, and then they're better. The pattern that we want is really this one. We want to get them less and less and less flare-ups with more time in between. We want the interval between flare-ups better. And this is really the goal for every patient that we're trying to achieve. What's interesting is that it can be sometimes easier to do, and sometimes it's much harder to do. This comports very well with the Asia Pacific guidelines. This is from 2013, and we can see here that this is very much what they're talking about, getting patients to good control with few flare-ups over time. And I truly believe, this is a little bit of a maybe controversial take, but I truly believe that if we can get patients better and keep them in this better state for some time, that many patients can go into a state of relative remission. We can find that we can actually decrease their treatments overall. So I think we're seeing more and more of this over time. I think about 5 different pillars of disease, areas we can focus on: the skin barrier, the psyche or the mind-body connection, inflammation, the microbiome, and itch. And all 5 of these are very important. And each patient can have differences where we have to cater to these or concentrate on one aspect. When we talk about integrative approaches, it's an entire universe of possibility. There's so many treatments out there that the number one thing I say when people ask me is, I don't know. There's just so many possibilities. So to help us, and really just to give us a little bit of a taste of what we can think about in this domain, I use 3 different filters, and these really are to have some clinical evidence. I need to have some evidence that it works. we have to have some general reassurance that it's safe. And then it also has to be practical, because we know that if it's very complex or very expensive, or if you need to do additional training, then it's not really suitable for us. I mean, sometimes patients want to get, for example, traditional Chinese herbal medicine. I think it's a powerful system of medicine. I think it can help some of our patients, but I can't do it. I can't dabble in it. It's very complex. You have to have at least 4 years of schooling just to do that. So that would be a situation where I would refer out and say, okay, I'd like you to see a colleague that I know and trust, and I can work with them. But that's a little bit different. Here, what I'm trying to build for us is what I call my multidisciplinary integrative toolbox, things that you can actually use for your patients alongside using the conventional therapy. So it's a little bit of a different ask. And I think a good way to think about it is to illustrate with a patient. This is a patient we can see here, very, very active disease, lots of excoriation. Some of them almost have a prurigo type pattern. We can see there's crusting at various points. There's lots of oozing and open lesions. This patient was suffering tremendously. The whole family was suffering tremendously when I saw them. And I think this is a patient where we're going to go through and say, okay, what can I think about the skin barrier? What about the mind-body connection? What about inflammation? What's going on with the microbiome? And how can we address itch? We're kind of thinking about all of these aspects of disease. And of course, many of our treatments can address multiple things at once. Those are really good treatments too, but let's take a little walk down these, and we'll start with barrier. When we think about the skin barrier, we know that empirically, the more moisturizer people are using, the better they do. So sometimes when people visit my clinic, they're sort of disappointed. They say, boy, a lot of what you talk about is just using moisturizer. It's not very exciting. It's not very clever. And I say, I know it's kind of boring. It's not glamorous, but it's very effective. So that's why I spend so much time. And part of my job, I feel, is to find good moisturizers that have real science behind them, that are elegant cosmetically, and that patients like to use. So that is much easier said than done. And I even had teachers who would say, oh, just pick any moisturizer. I don't like that approach, because sometimes people pick strange things. Maybe sometimes they'll even pick things with fragrance or exfoliating beads or things that are really not idealized for this. So I like to give some options. And my favorite thing to do is bring some samples in the room and say, okay, let's try these together. Try this one. What do you think? And when a patient says, oh, I love this one, boy, you know they're going to use that, right? When they actually say they love it, and especially true for kids, where little kids sometimes say everything stings and burns. If I can find one that they like, they tend to do so much better. I say, this is your moisturizer now, you know it. Some of the things that I love to incorporate into my treatment approaches are things like sunflower oil. It turns out that sunflower oil can actually induce endogenous production of ceramide fats, which is amazing. It also has some anti-inflammatory properties. This is a paper from Larry Eichenfield in San Diego a few years ago. I love this paper. And of course, you can use sunflower oil by itself, or it's sometimes actually incorporated into products, which I really like. And this is actually a study looking at a sunflower oleodistillate, an oil distillate that was present in a moisturizer, and showing that it actually outperformed a control group in terms of lichenification. Really, really exciting to see this. And what I love about this is we know this is the kind of data that we want to help inform us. Now, is this as good as a drug study where they're going to have thousands of people over multiple sites and replicate it? No, but those are very expensive and very difficult to do. Here, the stakes are much lower. We really are just adding a special moisturizer, but I think this is very compelling data to see this. We also know that there's been a beautiful split body study, olive oil versus sunflower. So the olive oil was used as a control, and the olive oil group actually made things worse on the skin. It decreased stratum corneum integrity, it increased epidermal water loss, and actually caused some erythema. But the sunflower oil group did better. They preserved the stratum corneum integrity, improved hydration, and didn't cause any redness. And then sometimes people ask about the safety, and I'll just summarize by saying there's actually a long tradition in Bangladesh of using it in premature babies, the tiniest babies, sometimes less than 33 weeks of gestational age. And even in this group, not only does it appear to be very, very safe, it actually was effective in decreasing death. It's amazing set of literature, because we know these babies often have impaired skin barrier because their skin is so immature. The application of sunflower oil actually decreased sepsis and decreased mortality. In other words, sunflower seed oil saved lives. More recently, a study came out showing oral hemp seed oil, taking hemp seed oil by mouth, actually seemed to improve atopic dermatitis. This was again compared against an olive oil control. Remarkable. Here we're thinking that ingesting these polyunsaturated fatty acids can lead to decreased dryness, decreased itch, and decreased use of medication. Remarkable, right? So these are natural products that maybe we're not thinking about using, but we really can leverage them, again, especially along with more conventional therapies. This is another patient of mine with a very dry, lichenified type of atopic dermatitis. This patient had terrible behavioral piece, scratching and rubbing constantly at the skin. And that really brings up the mind-body connection. And we could spend each one of these, we could spend hours on, of course. So I'm just giving a little taste of them, but we only have a short time today. The one study I like to represent this is there was a study. This is done by Dr. Larry Schachner in Miami, who found that 20 kids with atopic dermatitis, age 2 to 8, they either got topical care only, or they got a massage for 20 minutes along with their topical care by their parents. And remarkably, there was significant improvement in all the clinical measures: redness, scaling, lichenification, excoriation, and their subjective experience of itch compared to the control group. So just the moisturization, it also seemed to lower anxiety levels. So what a neat little thing to do, to say to families who are desperate and want to do something, why don't we try this? It may help with stress. It may actually help with outcome. One of my adult patients, extremely dry skin, very inflamed, miserable. That patient was erythrodermic, red all over the body, covered in inflammation. Now, we know that inflammation is present, of course, in the plaques of eczema, but also everywhere, even in normal looking skin, sort of non-lesional skin. It's not really normal. And one of our favorite tools in our toolbox is our topical steroids, which can help a lot for inflammation, but many of my patients are frightened of them. There's a lot of corticosteroid phobia. In fact, most of my patients now, I would say the majority, come and say, I don't want to use any more steroids. And that's very tough, because that is something we use a lot, but we also want to try to work with our patients and families. That's not the only fear. People are afraid of the calcineurin inhibitors. They have a black box warning. Antibiotics, preservatives like parabens, people are nervous about them. Chemicals in general. So are there some more natural things that we might be able to leverage for inflammation? Well, a couple. One of them is topical vitamin B12. Very interesting. This vitamin seems to have an effect on nitric oxide synthase, which is thought to actually trigger flare-ups. So by blocking that, we might be able to prevent flares in atopic patients. 2 studies, both in remarkable journals. One of them was actually in the British Journal of Dermatology. And this really was a randomized, placebo-controlled, multi-center trial showing that topical vitamin B12 really helped. We actually have it made for our patients. We have a compounding pharmacy put it together. One of my patients, she thought it was so pretty, the color, she called it pink magic. So that's what we refer to it as. Very gentle, very safe, and a moisturizing base. A wonderful, wonderful little product. More recently, just a couple of years ago, out of Germany, a paper came out showing that for facial eczema, now this included both atopic dermatitis and contact dermatitis, they had the patients do a compress with black tea. And this is a remarkable change. They actually did it very much like a drug study. They have a facial easy score, pruritus score, the investigator global assessment. If I didn't tell you what this was about, if I said this is a new molecule from such and such drug company, you would say, oh, wow, this looks to be a very effective new drug. What's the drug? Well, it's in your cabinet right now. It's black tea. That's all it is. And so I made a handout for my patients, and I tell them why we're doing this, and I give them very specific directions. I actually ask my patients to keep it in the refrigerator because I want it to be nice and cool. I don't want them to ever burn themselves with it. So it stays in the refrigerator, but they can do a gentle compress with it. Remarkable power. And it's really changed my approach. Now, the microbiome is maybe the final frontier of medicine. We are learning so much about it. There's just so many exciting things happening there. And again, we could talk all day about it. In fact, I just attended a microbiome conference all about the microbiome. But a couple of things where this interacts with our natural approach would be things like coconut oil. So coconut oil is remarkable because it actually contains these monolaurins, which really show broad spectrum antibacterial activity, particularly against the bad guys on our skin. And there was a beautiful study done in the Philippines where they had patients with atopic dermatitis apply coconut oil. And again, they had an olive oil control group. The coconut oil group decreased their Staphylococcus aureus colonization by 95% compared to only 50% decrease in the olive oil group. Another study compared virgin coconut oil compared to mineral oil in 117 children with atopic dermatitis. And again, found that the virgin coconut oil was superior to what was seen in mineral oil in terms of decreasing the SCORAD. Remarkable. So there really may be something to this. And there are so many other exciting things happening with the microbiome, from topical probiotics to different antibacterial enzymes and so on. So many, many things. And then finally, we have itch, a fascinating area that's quite underserved. So many itchy patients come into my office. And there, again, have been a lot of new understandings. Of course, this is not just a skin problem. This is also a nerve problem and a brain problem. So both peripheral and central nervous system. And one of the exciting areas has been cannabinoids. These cannabinoids are fascinating because there are cannabinoid receptors for endocannabinoids in our skin, in our nervous system as well, even on fat cells. So they're all over the place, and they can have an effect probably on itch and on inflammation and probably on oil production in the skin. One of the it's sort of not a true cannabinoid. It's actually sort of a helper of cannabinoids. It's called PEA, palmitoyl ethanolamide. And what's remarkable about this, it sort of helps the binding of endogenous cannabinoids in our body. And this has been studied as a topical preparation. It seems to help decrease itch, and it seems to improve dryness and lichenification and scaling. So this is remarkable. It actually decreases the amount of topical steroid use by 62%. Remarkable, very, very safe as well. Here we can see, looking again at PEA in terms of itch, really helping statistically significant improvements in itch when PEA is applied. Remarkable. Another modality that I trained in formally that I'm very interested in is acupuncture. And so there was a fabulous paper from a number of years ago showing that patients with refractory itch from kidney failure, they were randomized to get acupuncture at one point called large intestine 11, which is on the arm, 3 times a week for 1 month. And remarkably, they had a significantly lower itch score at 1 month and 3 months compared to the placebo group. And the p-value was less than 0.001. And this was against a sham group, a pretend acupuncture point. So this is really a beautifully done study. So I said, can we do something similar? And we were able to do it with acupressure using a fingertip or one of these little beads at the same point, large intestine 11. You can see it there on the arm. And remarkably, in our little pilot study, we showed that patients who got acupressure did significantly better in terms of itch than those who didn't. So there is something to this, and some of this may be behavioral, some of this may be mind-body. That's okay. However it works, I don't know, but it really did seem to work, which is really remarkable. And I still, to my patients to this day, I'll say, hey, listen, when you're feeling itchy, I want you to find this point, and I show them, and I want you to massage that point a few times a day when you can, or a few times a week, whenever you're feeling itchy, and do that. And it's really one of those nice little pieces that we can use to help. Now, how do we put all of this together? And again, I know we're just touching very briefly on these areas. There's so many different things we can do, but what I'm really aiming to do for a patient is give them a comprehensive plan. I like when they leave my office, I want them empowered. I write this out for them, and I try to explain what we're doing and when. So for example, when you're flaring up, you're having your skin's itchy, it's miserable, it's red, it's oozing, you're going to do the following. And maybe I'll have them do their cortisone here, and I'll have them do good moisturizer. I'll have them take their supplements, and we'll have a morning plan, a night plan, their gentle cleanser. We have everything laid out for them. And then I'll also have what to do when they're feeling a bit better. So they can do that when they're flaring up. And then when they're a bit better, they can have a gentler plan. And maybe in the gentler plan, they wouldn't have to use a cortisone. So we can have them use either just a good moisturizer, or maybe a non-cortisone treatment like a calcineurin inhibitor or one of our phosphodiesterase 4 inhibitors, or so on. And this way they leave feeling incredibly empowered about where they're going. And so I like this. I kind of put here that for example, the mometasone, a steroid, works for inflammation. Maybe we're mixing it with some mupirocin or having them use that to open areas for antibacterial, the microbiome. The moisturizer is helping with skin barrier. So is the hemp oil, and so on and so forth. So we can actually explain to them why we're doing these and which aspect these address. And of course, at the top, just giving them a printed plan, empowering them. So many patients have said, wow, you know what? This has helped me here. I feel empowered. My anxiety went down now because now I feel like I know what to do. You've given me the tools to help myself. So I don't feel like I'm nervous or I have to call you and ask a question because I don't know what to do next. So putting all those things together, there's no doubt that modern medicine is incredible. In fact, we're in the beginning of an incredible time for atopic dermatitis. We have biologic treatments, we have JAK inhibitors, we have new small molecules, new topicals. It's a fire hose of excitement. But this is because we're willing to take from other traditions. We keep learning, we keep growing, we keep admitting that we don't have the answers. We're questing, right? That is the ultimate scientific declaration, is to say, I don't know. And now I'm learning how much I don't know. And that's why we have to keep learning. That Socratic ignorance is critical. And in so doing, by admitting this, by connecting with our patients, and by telling them we're willing to try things, we're willing to explore with them, we're willing to make it work, that is how we connect with them. That sets us apart. I'm not a scientist. That's not my goal. When I walk into the room with a patient, say, I'm Dr. Leo, and shake their hand, no. I'm not a scientist. They're not an experiment, right? They're a person. We're people. And I'm their doctor. I'm trying to help them. And I'm, as a clinician, I have to do whatever I can to get them better. In that moment, they are my highest goal. They're my priority. So I'm not thinking about a population. I'm not thinking about the cost for the insurance company or the state or the government. I'm thinking about what can I do for that patient. All of those things come together in that moment to get them better. I hope you enjoyed this brief little foray into this world.
I'm so happy to have listened to the 5 pillars you presented, because I will go on with this, presenting a new emollient and a new way to develop a natural emollient with a prebiotic and called Stellatopia Plus. But before I present you what's going on within the skin, and Dr. Leo, you said the first pillar was a defective skin barrier, and this is really the fact at the beginning of atopic eczema. You have this defective skin barrier, which leads to any inflammation. And then it leads also to dry skin because the water gets out of the skin. And it also allows allergen and pathogens to get within the skin. And so it produces very special inflammation called Th2, which produce chronic pruritus and chronic inflammation. And this inflammation too decrease the defense against bacteria. And that's why Staph aureus proliferate, and that's why I think it was the third pillar. That's why there is a disbalanced microbiome. And so with time and with chronic pruritus, patients scratch, and so they alter the skin again and again. And so Staph aureus organize itself in a biofilm, which lead to a more inflammatory state and also to a more resistant state to antibiotics. So you see that there is a defective barrier from the beginning, at the middle of the atopic dermatitis evolution, and even with time, you always have a defective barrier. So that's why emollients are so important, and that's why moisturizers are the cornerstone of the both prevention, treatment, and maintenance in atopic dermatitis. And you said that the emollients are really part of this complementary and alternative medicine. All international guidelines say that they should be applied twice daily, every day. And so I wrote in red the target, the most important targets for a specialized moisturizer for atopic dermatitis. So a moisturizer should be really hydrating and improve skin barrier function. It should relieve, of course, symptoms of atopic dermatitis. Because of the ingredients in the cream, it should both restore lipids, but also reduce inflammation. The cosmetic properties should be nice with a good absorption within the skin, and the pH should be physiologic, which means acidic as the skin. Moreover, a good moisturizer should promote a healthy microbiome, have a corticosteroid sparing effect. Professor Leo told about corticophobia. And so if with emollients every day, you can spare 50% of application of steroids, this is terrific. Alone or complementary to treatment, it will prolong time to flare. And if it's elegant and cosmetic nice, you see that patients will improve adherence and compliance, which is such a difficult problem in all chronic illnesses. And we all know in our practice that everything which is chronic is difficult to treat, but especially in atopic eczema. You see this publication showing that what you recommend, the treatment falls by 70% within the first week of treatment. And why do people quit the treatment? Because they don't understand the condition, because they find the treatment inconvenient, they forget it, and they have concerns about the side effects. And I'm sure they have a lot of trust in you, Professor Leo, that's for sure. And you see this publication on parents' perspective on adherence to medication for their child with atopic dermatitis, and only 50% are taking or applying eczema medication as you recommended. So this is not enough. We should improve this. And so this is why we wanted to provide a new emollient in atopic dermatitis, a new formula to meet parents' expectation. And how did we do this? We did it because we formulated the product with parents. So this new emollient is 99% natural. It has no perfume. And it has a very basic formula made of with a lot of lipids. Dr. Leo spoke about sunflower oil. We love it. We added avocado oil and shea butter. They are all organic ingredients. And then we also add patented active ingredients, sunflower distillates, many publications about this one, and prebiotic for the microbiome. So a quick overview on sunflower distillate. We have a real know-how to build this active ingredient with molecular destination, and it's very, very concentrated in lipids. And so it learns the skin how to make relipidation. And also it repellent the inflammation because it has a target of a specific called alpha, very important in eczema. I will emphasize on the second one called bioecolia. It comes from natural sugars and it's a prebiotic, which means that flora might eat it. But the very specificity of bioecolia is that it is bioselective. So it only stimulates the good flora, the saprophic flora you see on the left-hand side of the slide, but it inhibits the development of pathogenic flora because it's not a good substrate for Staph aureus. So it rebalances the microbiome. This is the first quality of bioecolia, but it has a second one, which is to stimulate the skin to improve immunity. In our skin, we have what we call innate immunity. And so there are molecules called defensin, which are activated when there is a bacteria. And so in our lab, we did a model, a skin explant, and we did put bioecolia on it. And you see that the green staining is increased. So defensin are increased by bioecolia on the skin, which means that bioecolia rebalance the microbiome at the surface, but also it teaches the skin how to defend itself against bad bacteria. And so, and this is the active ingredient and the lipid formula within the Stellatopia Plus cream. But you see, you know that the formula and the consistency of the cream is very important. That's why we wanted to make a co-construction with parents in a three-step basis so that parents like the final product. So first we did focus group with parents of children having AD. And so we wanted to know the sensory descriptors relevant to them. So how do they describe the emollient they like both and the best quality? There were adjectives, but very different adjectives. So we worked with experts in sensory analysis. And so we gave them the adjectives of the parents and told them, okay, make this technically scientific. And so we gave them 5 different formulas of Stellatopia Plus with different surfactants, different preservatives, and also 2 competitors. And we asked them, please describe these formulas. And we went back to parents and to do a consumer test on their child. And so they had to use 7 products and describe the perceived efficacy and the perceived cosmetic qualities using the expert terms by the sensory analysts. With this, we could put the result of the 7 formulas on what we call a preference mapping. You see in the middle of the slide. And the points in the red area are the product parents liked. And the points in the blue area, it's a parent disliked. So you see there were still a lot of points in the red area parents liked, and their preference criteria was a good penetration within the skin. But so to make and to choose the best product, we added objective measures of hydration and skin barrier enhancement. And so you see we choose P2 on above the map. It's called Stellatopia Plus. So it was the best formula, cosmetic qualities preferred by the parents and the best for hydration and skin barrier. We did a study in our lab with Stellatopia Plus with the final formula on biofilm. I showed you on the first slide the importance of this organization of Staph aureus in a biofilm. So it is important to rebalance the microbiome, but also to fight this biofilm. So I won't go into details, but you see after 6 hours that you don't see any glue. It was a yellow arrow. and it is more visible after 24 hours. On the left-hand side of the control, you have many, many staph aureus with this glue above them. And on the right-hand side, you have less staph aureus and no biofilm anymore. So Stellatopia Plus has a really preventive effect against biofilm. So, of course, we always do clinical studies under dermatological and pediatric control. And that's what we did with Stellatopia Plus. And we conducted quite a long study because 3 months is quite long for studying an emollient. And it was among 63 infants and children with mild to moderate AD. So general results showed that after 1 month, the itching was decreased by 84%. It has a real potent anti-relapse effect because you see that 90% of the children did not have any eczema crisis during the 3 months. It improves their sleep, and also, although parents were allowed to apply corticosteroids during the study, none of them did it. So it's a really strong corticosteroid effect. I show a brief overview of the efficacy on the intensity of atopic dermatitis, focusing in the middle on what we call POEM. It's patient-oriented eczema measurement. So it's what patients feel and live about their eczema, or parents for their children. And you see that after 1 month, the intensity of the eczema was reduced by 40% and by 60% after 3 months. In Wistela, we always study the quality of life, both of the parents and the children. And we did 2 questionnaires for the children, and you see that the quality of life was very much improved. So to sum up, new Stellatopia Plus meets all criteria of a natural emollient. It's part of a brand with gentle cleansing products and with a brand new Stellatopia Intense you have in US for eczema rash and flare-ups. I hope you will love this product. And I thank you very much for your attention. Seeing you, some before and after photos, I could show you more, but I think it's really a very nice results with this new emollient. Maybe Dr. Leo is organizing the Q&A session.
Sure. I can bring up a couple of things that were in the chat since people might not be able to see it easily. But one of the questions that came up was, how do you balance this issue of using food-based oils? I mentioned coconut oil and sunflower oil on the skin, or foods in general on the skin, when we know that one of the ways people can become allergic is what we call transcutaneous or epicutaneous sensitization. By putting those things on the skin, is it possible we're going to sensitize them to these things? And the answer is yes, it is possible. But we think that all the different food things we're putting on are not equal. So I put a reference in the chat. There's a wonderful paper from Alan Irvine where they wrote a paper about oat products in a lot of the moisturizers. So many moisturizers have oat in them. And the same question was raised. Are we sure we're not making oat allergy? And their quote I thought was beautiful. They said, given the wide use of oat-containing products and the extremely low incidence of clinical reactions to oat protein, the real-world risk of percutaneous sensitization to oat leading to clinically significant reactions must be very low generally, and specifically much lower than to other more allergenic foods such as peanut, unquote. So I think the same thing applies to things like sunflower and coconut. Now, is it possible that we'll see some of those allergies? Yes, I do have a few patients who are allergic to sunflower, a few patients who are allergic to coconut. The truth is, for those patients, I probably would avoid those oils. And I think it's a good general idea for somebody with eczema to try a small area first on their skin. But remarkably, especially fractionated coconut oil, for some of my patients, and again, I wouldn't recommend doing this without having an allergist involved, but they can actually still use fractionated oil because the amount of protein in some of these oils is so low that it doesn't trigger a response. Sometimes, we can see different preparations, and that's why we have to be a little bit careful recommending them broadly. So I think we want to test for that. We think the overall risk is extremely low because, of course, culturally, many cultures use coconut oil and sunflower seed oil for generations, and we haven't seen these allergies develop. So I think that's sort of the long answer.
Thank you, Dr. Leo. I think you have answered a couple of other questions related to product selection as well.
Yes, where to find good products for patients with sensitive skin or eczema-prone skin. I think that part of it is things like this. We're learning about companies that are committed to looking at patients with sensitive skin and eczema. So that means a lot to me. There's also a database that the National Eczema Association keeps up, and I put the link here in the chat, and it's called the Seal of Acceptance. And a group of people will actually review these products, and if they deem them favorable for patients with sensitive skin, they actually put them on a list, which is wonderful. And there are some guidelines about what can and can't even be considered. Certain ingredients, they say, no, we can't even consider that. For example, things with fragrance, they don't really want those being considered because we know, not that those are bad products by any stretch, but we know that enough patients with atopic dermatitis or eczema have sensitivity to that. So we try to have those removed. It's a very nice list. There are many products on there, so it's a place to start. I think the other place I learn about products is from my patients. I give them samples and have them try them, and I get feedback. And so it's really nice when they say, boy, this Mustela product was wonderful. This helped me. It helped the baby. It helped the sister. We have a whole bunch of people. And then you remember that. And I think that's really important too, to get that kind of real world experience with patients, so that when you give it to a patient who's sensitive, you say, I've had other patients who are sensitive really like this one. Why don't we try it? So part of it can be a journey, and I think patients enjoy it. It's a good part. I want them not just for it to be helpful. I want them to like using it, because that's going to help reinforce it for them.
Great. And how about sunscreen? I saw a question about what type of sunscreen or sun product to pick for eczema-prone skin.
Yes, I'm very picky about my sunscreens too. I really want something that ideally is mineral based. I try to avoid all the chemical sunscreens, especially in sensitive patients and in kids, because while it's true, sometimes mineral sunscreens do leave a whitish cast. They can be a little bit thicker, but I really think that the trade-off is so worth it, because a chemical sunscreen, while it might go on well, it can be irritating. It can be sensitizing. And littler kids, they may absorb it. So we don't always know. I've had families bring in a newborn baby, just like a month or two old, and they say, oh, we're so good, we put sunscreen on 3 times a day. And I say, oh, wait a minute. Like, I don't think we should be putting it on this little guy. I mean, this baby shouldn't be out in the sun. This is a 3-month-old baby. You're going to put a bonnet and a hat and keep them under the protection. So that they meant well, but I don't think it's wise. And then it was a chemical sunscreen. So I said, golly, we just don't know. So mineral-based sunscreens, Mustela has a line. They have a wonderful moisture sunscreen stick. That's really nice. A lot of my younger patients like the sticks as well, because they're easy to put on. You can see where they go, but it's very, very gentle. So I think that's a great place to start.
Thank you. I believe we've covered all the questions. If it's not the case, please drop your notes or your question very quickly. Otherwise, thank you so much, Dr. Leo and Dr. Debelilovsky, for your presence today. I think your presentations were amazing and very insightful. So thank you again. Thank you for joining the webinar. As I said earlier, it was recorded. We will post that on MustelaMD.com website, so you can access that over and over to go back to those amazing presentations. Just want to quickly mention that Mustela will be at the AAP this fall in Washington, DC. So hopefully we'll get to meet in person there. But feel free to come see us and try the product. We'll have some samples. Thank you so much and have a lovely rest of your day. Thank you.
Bye.